Healthcare costs keep rising exponentially in America. It's a major drag on our economy, and it's not really showing any signs of getting better. What's going on? That's a very complex question. There are many factors. I might make future videos about that as a broader topic and go more in depth about specific issues that could be addressed. This is meant to be a short YouTube video that offers some practical value to you as an individual. How can I help you decrease your healthcare expenses, specifically your dental care expenses? I work as a dentist. I see who gets stuck paying lots of money for dentistry, and I see who doesn't spend much money on dentistry. Here's something that might surprise you. Wealthier people tend to spend less money on dentistry, at least when it comes to dentistry that is trying to correct a health issue. Wealthier people may spend more money on cosmetic dental procedures to improve their smile, but for the most part, it's people who are less financially well off who are spending extra money at the dentist. Why is that? That gets complex. There are lots of reasons. I don't have a collection of scientific studies to show you that proves any of this definitively. However, I do have my observations from years of seeing different patients. A person from a wealthier background likely had consistent dental care growing up. And I don't just mean care at a dental office. I mean dental care at home. The World Health Organization and many other dental health agencies and individual healthcare providers have come to the conclusion that early dental health habits established in the home and family environment are far more predictive of lifelong dental health outcomes. Long sentence, what does that mean? What does that mean? If your parents and family members model healthy habits, then you pick up on and grow with those habits throughout your life, and you stay healthier as a result. Kind of common sense, right? Habits at home are far more powerful than care in a dental office, a place you spend very little time in, relatively speaking, throughout your life. Habits become part of a daily routine to keep your mouth healthy. The dentally healthy and wealthy don't even have to think about these habits. It's just part of what they do. I have seen lots of patients who have never been to a dentist or who have not been to the dentist for many years. They were never taught very basic information about how to take care of their mouth. They never had healthy habits built into their routine from a young age. Even worse, many of them have been falsely taught that they have bad teeth. Whether that's their family telling them that or the media telling them that, they learn that bad teeth run in their family. They think that means that their dental problems are primarily genetic and therefore inevitable. This is a failing by healthcare providers such as myself to educate the public properly on certain nuances of biology. Are you snoring yet? No, don't worry. I'm not going to take a deep dive into a lesson on genetics in this particular video. Maybe in another video at some point, but let's keep rolling. If you have healthy habits, those daily positive benefits compound over time, right? To keep you really healthy. If you exercise regularly, it's really easy to stay in shape throughout your life. It doesn't even feel like something difficult, right? It can be fun and enjoyable. And that probably sounds insane, to some people, but it's true, right? It's hard to believe exercise could ever be enjoyable, but that's also not something I can really prove to you intellectually, right? You have to feel it for yourself. I can't talk you into a dopamine or serotonin hit. I don't know, if you need some intellectual proof, there are actually some interesting studies out these days about the positive benefits of exercise for combating depression, for instance. I've had my struggles with depression over the years, and in retrospect, I think regular exercise, that habit, even when I was depressed, was one of the things that has helped me to keep that at bay to a degree. Hasn't fixed it completely, but definitely helped me modulate and regulate it to be less difficult than it otherwise would have been. But anyway, if you don't learn how to exercise until you're in your 30s or 40s, it does become a much greater challenge to get in shape, right? You're having to reverse all sorts of negative compounding from unhealthy habits as opposed to continuing to ride the momentum of your healthy habit foundation built from a young age. Now, I don't want to develop a defeatist attitude in anyone here, right? That doesn't mean it's impossible. You've just got a greater challenge ahead of you, right? In a way, that can actually be inspiring, right? You're going to have to work harder for this, right? That means you're going to have to overcome more than some other people did, right? That means you can eventually become stronger than them, right? Weird, but true, right? You have a higher mountain to climb. That's a more impressive achievement in the end. What doesn't kill you makes you stronger. You really shouldn't wish for an easy road, right? You want adequate challenges that push you to grow in life. All right, off my soapbox, back to dentistry. I want to help you build your healthy habits, right? Here's the problem with my job right now. I see lots of patients after their mouth has already been beaten up by years of unhealthy habits. A typical patient only comes in to see me when it has become obvious to them that they have a serious problem, right? They're in pain, they have swelling, a tooth fractured, a tooth is loose. This is not the ideal time to step foot in a dental office. A lot of times these patients are scared of dentists like me, right? Dental offices are an unfamiliar environment. Patients don't trust what I'm saying. It all sounds like gobbledygook nonsense. People are scared of the unknown. Dentistry is like a big old boogeyman for tons of people, right? So you're in pain, you're scared, you don't know or trust me, and then you find out it's going to cost a bunch of money to fix the problems that you have. Turns out you don't have a bunch of money. You ask if your insurance covered it. It does not, because in fact, dental insurance is not insurance. That is a misnomer, technically speaking. It's a lie. It's more of an elaborate discount program that doesn't work very well in a lot of cases. That's a whole separate video essay, but dental insurance, it's not really insurance. So, now you have to make choices from a position of weakness, right? You're put into a corner where there are financial pressures on you. You aren't sure what the best treatment option is for you. You're in pain, so the decision you have to make is time sensitive. And patients end up making a lot of less than ideal choices in these scenarios, right? It's common. Now, I try to counsel patients to make the choices that are best for them in their given circumstances, right? That can involve a compromise from making what I would consider the best choice. Ultimately, it's about the best choice for you as you are, right? I have total respect for that. My job is to help patients understand choices so that they can make them based on their priorities, not what would be my priorities. However, I still would prefer fewer people get stuck in such a difficult situation in the first place. It's a really inefficient way to access the healthcare system, and it's part of what's causing our healthcare system costs to skyrocket. Emergency dental care is the most expensive and least efficient. It costs the most money, and you get the worst results. That's a bad deal. It's a fair deal, right? It makes sense that it costs what it costs because emergency treatment is the most difficult, most time-consuming, and requires the most training, right? If something is really hard, it should be more expensive. No one is going to do the most difficult, riskiest job for the least amount of reward, right? So it is a fair deal, but it is also a bad deal. What's a better deal? Preventative medicine, right? Stopping problems before they get out of hand. Preventative medicine is both less expensive and gets you better results. That's a great deal. That's a great deal. That's a great deal. I'm going to say it multiple times. That's a great deal. So that's one of my goals with this YouTube channel, right? To build your confidence with dentistry. I want to teach you how to take care of your mouth. I want to teach you how to take care of your mouth. Take care of your mouth. I want to help you build those habits in your life. I want to build your confidence in going to see a dentist so that isn't such a scary, uncomfortable environment for you. And I want you to pass on that knowledge through your actions to everyone who is going to look up to you for having such a beautiful, healthy smile. You're gorgeous. Come on, stop it. You're ridiculous. Quit it. No, there are all kinds of reasons our healthcare costs are soaring into the stratosphere. But personally, I can't implement sweeping changes to how our dental and medical schools operate in America, all right? I can't change how insurance companies interact with doctors and patients. I can't slow down the corporate takeover of medicine that is turning people into numbers that contribute to a bottom line instead of human beings. I have very little control over all these giant macroeconomic trends. A lot of the garbage that is getting served up as healthcare in this country is pretty scary to me, right? It's frightening, but I can't change any of that, right? Not on the macro level, only on the micro level. That's going to require lots of good, honest people distributed throughout these systems to talk back loudly and forcefully when the people who write their checks try to get them to do something unethical. That's going to require people to listen to their conscience and act when they get an inkling that what they are about to do is going to be a violation of their responsibilities to their patients and to our society as a whole. That's a massive job, and I can't do jack crap about it other than to try to live up to those principles in my own work. You can contribute to the macro on the micro level. However, I can do a better job of communicating with patients who feel lost in these systems. Technology, right? Fancy microphones and stuff and video cameras. Technology has amplified our ability to communicate. I believe systems work best when participants in the system are properly informed in transparent and honest ways. I want to contribute to that, right? I want to help with that in the dental healthcare sphere. So, check out my videos, ask me questions, help me understand what you don't understand so that I can help to clarify. I want to build a library of content that helps patients keep themselves healthy at home and, when they need it, to utilize our dental healthcare system more efficiently and effectively. I think that's a good deal for both patients and healthcare providers. I think it will make the system run more smoothly, and that means better results for everyone involved. It's a win-win for providers and patients. I want to help repair and improve that relationship. This is a two-way street, right? In terms of responsibility, yes, healthcare is expensive because getting care from providers is expensive. But as an average person, you still have options open to you to decrease the costs. If your habits cause your health to fall apart, then healthcare will be more expensive for you. That's just a cold, hard fact of reality. I'm also not saying that your current habits are your fault or that you're a bad person for not having healthy habits. Life can be brutally hard, okay? I don't know what you've been through, and I'm not judging. But I still know that there are certain things you need to do if you want to maintain health. It may not be fair that life has kicked the crap out of you, but the only way to recover is to set up the right healthy habits and slowly climb your way back. There's just no other way to do it. Unless you want to spend a ton of money. But also that still doesn't work as good as the healthy habits, right? You really can't buy health. Health isn't, maintaining health through your actions on a daily basis it's less expensive and it's better. It just is. All right, hopefully the YouTube algorithm kicks this video toward the eyeballs of some people who would benefit from seeing it. Just a reminder to please like, share, subscribe, send to all of your friends and family. All subscriptions this week will be donated to a local canned food drive. Pretty nice. No, I'm just kidding. Today we're sponsored by the dictatorships in Venezuela and the United Arab Emirates. Let's see, we're in charge so you don't have to be. Flying Emirates, wow, oppression has never felt so good. Friendly reminder, if you try to join the Mile High Club, we will stone you to death. It's from our sponsor, Venezuela and the United Arab Emirates. Good luck with your teeth. I think we should all bow down. We should all bow down to the real dictator, YouTube, right? Let's be honest, who's really in charge here, Who do you think's paying me money to lie to you about your teeth, pulling the strings, huh? I'm funded by State Farm commercials, baby. Yeah, me and Chris Paul are in cahoots. All right, like, share, subscribe. Bye-bye. Toodaloo, you freaks.